MMT, scapular adduction and downward rotation, rhomboids. Assist the patient to the prone position. The head may be turned to either side for comfort. Position the shoulder in internal rotation and the arm adducted across the back with the elbow flexed and hand resting on the back. Stand at the test site. Using your arm, support the entire arm from the elbow to the shoulder joint. With the other hand, palpate the medial border and inferior angle of the scapula for adduction and downward rotation. You are not assessing the infield, you are determining how much range the patient is able to move the scapula in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to lift the hand off the back while maintaining the same arm position across the back at the same time. Stabilize the patient across the back with your arm. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the middle trapezius, which results in scapular adduction only. You may see the elbow rise higher with this substitution. Recall that this test is designed to test the strength of the rhomboids. The resistance will be applied at the humerus, and it is allowed to break with the resistance since we are not testing shoulder strength. However, the scapula must maintain the adducted and downwardly rotated position throughout the test. After correcting any substitutions, stabilize and ask the patient to perform the motion as previously. If the shoulder extensors are grade 3 or higher, the hand used for resistance is placed on the humerus just above the elbow. If the shoulder extensors are less than a grade 3, place the hand for resistance along the axillary border of the scapula. The resistance for both is in a downward and outward direction. Standing next to the test arm, use one hand to palpate the scapula for adduction and downward rotation and the other hand to provide resistance. Apply the force for a 5-second count. Grade 5, normal. Patient completes the available range of motion and holds against maximum resistance. The fingers will pop out from the scapula when strong rhomboids contract. Grade 4, good. The patient completes the available range of motion and holds against moderate to strong resistance. Grade 3, fair. The patient completes the full range of motion but does not tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Position the patient in short sitting with the arm internally rotated and the arm extended and adducted behind the back. Allow the feet to rest on the floor or step stool. Stand at the test site of the patient. Support the test arm at the wrist. With your other hand, palpate the rhomboids under the vertebral border of the scapula. As you support the wrist and palpate the rhomboids, ask the patient to attempt to move the hand from the back. Observe for any substitutions. Grade 2, poor. The patient completes full range of motion in scapular adduction and downward rotation. Grade 1, trace. Palpable contractile activity of the rhomboids. Grade 0, no palpable contraction.